when you're eating food, suckling or chewing or swallowing, with a sensory experience, you're using the same cranial nerves that you're using when you socialize. And so it is really actually a perfect co-regulatory pathway is to use food.
Hi, my name is Isabel. I'm a licensed clinical social worker and a certified eating disorder specialist with Into Place Therapy in Arizona. Today, I'm here with Dr. Kari Anderson. She's a nationally recognized eating disorder specialist with 35 years of clinical experience as a licensed professional counselor, a coach and consultant, speaker and retreat leader, and a mentor. She's a specialist in binge eating disorder, and she's developed treatment frameworks for eating disorders that are used by organizations across the country. So, super impressive. And she's written several books, but I want to highlight your published memoir today.
Okay.
Called Food, Body, and Love, but the greatest of these is love. So, Dr. Anderson, you have been a mentor for me, and you were my clinical supervisor as I was working through getting my certified eating disorder specialist certification. So, I'm really excited to have you
I'm so
today.
thrilled to be here. And I'm so excited for what you're doing with your eating disorder career. And um, anyway, so super pleased.
Thank you.
Giddy.
Yeah, that's a great word. So, you've done a lot of amazing work around food and body image and self compassion. So, can you tell us a little bit about what inspired you to get into that area of work and what led you to write your book, Food,
Great.
Body, and Love?
Well, Food, Body, and Love, but the greatest of these is love, is actually a combination of a memoir and a self-help book. And it came out of my belief that if I were to be more transparent about my story, my own personal recovery journey, that would help others. And so many people felt um, tell you to kind of keep your story private. And I've never felt that that is authentic, right? And so I did write it because I felt like it needed to be written. Um, and so my story actually started when I was 8 years old, and I actually developed what I know today to be, and I know I might use language that's a little controversial, but I developed a sugar addiction neural pathway. And I used it to help me cope at a time where I had very little ability to co-regulate. And I'll talk about that a little bit because I'm a follower of polyvagal theory. Because my mother was in a debilitating depression at the time, and my father was busy opening a brand new business. And at 8, I was left alone. And I don't necessarily believe that, the, there was a traumatizing sexual abuse from some neighbor children, had it I mean, you I wouldn't have had to have that, to have been dysregulated, but I was dysregulated, and I didn't have any co-regulation opportunity, anybody to help, um calm my nervous system, and so I learned how to eat sugar just plain,
Mhm.
um, just plain granulated sugar,
Cool.
and it worked, right, temporarily, but basically calmed me. I was able to feel safe again. The feelings, the interoceptive discomfort inside my body, went away, even if
Mm.
just for a little while. There's a long, story of following that, but, it really eventually led into more binge eating disorder, um, and a clinically diagnosed eating disorder. Through my, high school, college, athletic career, into early professional work. At the time, I was working in the athletic world because that was my first nutrition and exercise science was my first degree. And it wasn't until I got treatment that I went back and got my degree in counseling, and then subsequently, I got a doctorate later in life. So really, the memoir is about what I know to be true about the personal experience of having both an addictive quality to highly processed foods and also a binge eating disorder, which has the thin ideal pathology hooked
Mm.
to it, and the restrictive process, um, which results in a counteractive binge process. But it did start first, and a lot of people say that that the restriction, right? You know, this chicken or the egg theory.
Mhm.
But the restriction was not the first process for me. It was
Mhm.
actually the binge process, which later led to when body image issues when I was preteen teenager
Mhm.
led to the binge eating disorder.
Okay, and then you mentioned you were an athlete too.
Yes, yeah. No, I always have been, athlete. I consider myself an aging athlete now. That's an identity that I've had for a long time.
Mm.
Mhm.
And, I think you're hitting on something that I wanted to ask you about, and it's just that eating disorders are much more than just about what we look like or a concern with aesthetic aspects of ourselves. There's obviously a huge emotional component of them too. So, can you talk a little more about like what role emotions and stress play in an
Mhm.
eating disorder from your own experience
Right,
and from the people that you
right.
work with?
I wanna first conceptualize stress because stress gets a bad rap, I mean, I think that people feel like but um, any shift or change in our nervous system, that creates a felt experience or, in our bodies creates, discomfort because we've conceptualized it, "Oh, this is bad," right?
Mm.
And so, there's a mindset component to it as well. Um, but when it comes to fear and, in the book, I conceptualize stress as fear related. I also emotions are just a felt experience of, a energy shift in our bodies, a nervous system shift. And so we attach a narrative to it and tell a story in our brain as to what's happening. So, depending on that story or narrative that we attach to this bodily experience, um, will either create more and more stress. So I want you just to be thinking about this is uncomfortable or something bad's going to happen. Like from a sympathetic nervous system perspective, the fight flight. Um, Basically, we're preparing to mobilize in case this gets really bad,
Mm.
right? And to run or to fight or to do whatever. So we're on high alert when we're in the sympathetic nervous system. And then there is also an overwhelm state of stress. And many, many people get into that state of overwhelm. Will we kind of detach, dissociate, kind of collapse,
Mhm.
um, and isolate? So, and that's another protective feature, just the same as an animal might stop and drop and feign death. And so the predator will move on, be uninterested. So anyway, so back to the original question, and sometimes I can get off on trails, but
That's
I wanted to really understand what's actually happening. For mammals, and we are humans, the number one and the most preferred way, and the way we're designed to regulate is through co-regulation. Connect with a safe other, right? Communications, dialogue, facial cues, tone of voice, the porosity of voice in terms of the rhythm of the voice, the eyes, in terms of the gaze, the way that we turn our heads, even kind of body language or cues are our preferred method of regulation. That is our default. And when there is not a safe re- regulator, then what happens is we look for substitutes. Okay. So if you understand that as the conceptualization, and so for me, I didn't have anyone to co-regulate with, and I had a very strong attachment to my mother prior to that. Um, Very safe, but then, she was almost, well, she was very debilitated by depression to the point of having shock treatments and things like that. And so she was not available. So at that time, and she, bless her heart, this just to understand that from a later, this is not calling her out. This people have clinical depression, right? And she returned and the sun came out and we carried on. But this was a time for me to try to find an attachment um, to a false attachment, and food was it. The thing that was so fascinating to me, why I moved into this bottom up theory and polyvagal types of therapies, is because it made everything clear when I first heard it. It was like, when the skies part and you go, oh, now everything makes sense, right? And the reason why is when the um, founder of polyvagal theory, Dr. Steve Porges, he indicated that food and ingestive disorders, so for instance, the smelling of food, the sensational sensory experience, the chewing of food, the swallowing of food mimics the social engagement and attachment and co-regulation. So you're actually, from a neural pathway perspective, when you're eating food, suckling or chewing or swallowing, with a sensory experience, you're using the same cranial nerves that you're using when you socialize. And so it is really actually a perfect co-regulatory pathway is to use food. And so it was so validating for me and all of my clients to know that this is such a natural thing to do. And if you think from a survival perspective, what other thing? If you don't have, uh, if you don't have a mother or a caretaker or a father to co regulate with, let's co regulate on food because it's life saving, right? It's
Mm.
our life force.
Yeah, and TikTok wasn't available to our ancestors, so
And that's questionable too, going through, COVID and everything going into, telehealth and whatnot, and I do a lot of telehealth. We don't really know if it is a grand, substitute, and the reason why is that there are electromagnetic fields that also are involved that come out off of our heart, and our nervous system that we connect with as well.
and with the piece around trying to co-regulate with food, how does that work for anorexia, right, or bulimia, for
Right.
example? Slightly
Yeah.
different.
Well, everybody's nervous system is a little bit different. Those that have anorexia or restrictive disorders, actually, it's actually a form of hibernation, nervous system shutdown. And so they have less attachment or sensory experience to what's going on inside of them, or interoceptive awareness, or heightened. It's just very different. So what happens is when they ingest food, they don't feel better. When they eat food, they don't. They feel more distress. Okay, where somebody, let's say, that is more on the spectrum of emotional, what we would consider emotional eating or binge eating, when they eat food, they feel better. right? Even if it might be from a distraction perspective, right? I'm paying attention to my digestion, especially if it's a lot or a big load, then it's very distressing in the same areas that we might feel emotion along that digestive tract. But somebody that is has a restrictive disorder, it just makes them feel worse to eat. And so the regulation then is the other hormones or neurochemicals that come into play with starvation. And that actually makes them feel better. But essentially, it's the body protecting them from the process of death.
Mm.
And I know that someone says, "Oh, that's just so over the top, Carrie, that's so," but really, our bodies are always either striving to survive or they stop and drop, right? And so they're trying to conserve, their heart rates, move into bradycardia, they're cold, they, any kind of movement that they have, sometimes the hyperactivity that we see, we think they're trying to burn calories or it's exercise, but it also is keeping them from dropping further,
Mm.
right? It's to keeping them trying to move them through into that sympathetic nervous system so that they're staying alive. It's kinda life-saving. Um, so I think it really just depends on what it is that we're just all trying to feel better, right?
Yeah, fair enough.
And so we figure out ways that make us feel better. And so we're trying to, in a sense, we're trying to self-regulate, right? And so we think about self-regulation when absence of co-regulation, right, is our next step. And we learn all through all our mindfulness-based cognitive behavioral therapies, right? All the ACT, DBT, um, all the alphabet soup types of therapies are um, essentially what they're trying to do is to teach you self-regulation skills, right? And so we learn then how to regulate. Sometimes it's maladaptive and sometimes it's adaptive.
Mm. Mhm. And, with the piece around the self-regulation versus co-regulation, what's sort of the fine line between them, or, like, what's the balance that maybe we should
Mhm.
be seeking to achieve?
Well, I think co-regulation is, of course, the gold standard, but we can't always be with safe individuals,
Sure.
right? In fact, I think our world is getting less and less safe, right? I think in terms of we have more mistrust, there's more polarization. And so I think that having a great repertoire of self-regulatory skills, pets and animals count as co-regulation. All mammals are. And so that, for a lot of people, that's why we see a lot more of support animals.
Mhm.
Can be really. I mean, you look at the autistic child, and that's just a disorder of dysregulation, and the reason is hypersensitivity to sensory exposure, um, and everything is just times 10 to them from a
Mm.
sensory perspective, and so the heartbeat of, uh, a Labrador, right, where the lab can lay on them and regulate them just through their heartbeat, and their heartbeats will actually align. It's really fascinating.
That's beautiful too. Yeah, animals are good for that. And in your book, you talk about the difference between emotional hunger and physical hunger. So, can you describe the difference between the two and what they are?
Mhm. Well, they're becoming increasingly more intertwined and interwoven, um, because we can experience something that is a craving, which is what we would consider emotional. It's a it's it's a craving process, versus a physical hunger process. One is driven by reward,
Mm.
dopamine. Another is driven by, the processes of, hunger and fullness, ghrelin, leptin. insulin, all the hormonal processes. We know about the GLP-1. Naturally, it helps us feel satiated. So that's another peptide that we have naturally that now they're leveraging, right, to from a synthetic form. Um, but that type of hunger, um, the more, and that is one of the things I'm working on right now with a lot of my clients is um, how do we manifest from a mindset perspective, but how do we create a more balanced internal experience in terms of from our own cellular processes, our gut bacterium to our mitochondria, in terms of how do we optimize through the way that we um, entrain and balance our own internal system so that that all works well. But so many people are not, they're dysregulated in so many different ways that we're looking for external ways to be able to calm. So I know it's a really complex question with lots of different processes, but I guess what I'm trying to say is it's not as simple as it seems. Oh, this is natural hunger, right? That's a physical symptoms, and this is emotional or a brain reward system.
Mhm.
Okay, because they mimic each other in terms of what it feels like? So we can feel like crawling out of our skin. I've got to have that candy bar, okay? Um, and it will actually activate some of the processes in our gut that mimic hunger, and yet we ate an hour ago, or maybe even 30 minutes ago, right?
Mm.
So I guess what I'm saying is it really creates and needs a nuance that's not as easy. It used to be, okay, this is a physical symptom and this is an emotional symptom. And so I know what to do here and I know what to do here in terms of eating food because we can think we're hungry and we're not. So we have to really bring in our wise mind
Mhm.
to use a DBT term is that well it doesn't make sense because I just ate a meal. Or let's say I ate a meal that was very, very high in carbohydrates and I had an insulin surge, right? And then it dropped out my blood sugar.
Mm.
Well, low blood sugar is a sign of hunger. And so wouldn't that be physical hunger?
Mm.
And yet it was because our body didn't feel nourished because it didn't have enough of all the components that are necessary for the gut or the body to feel nourished.
Mm.
So we can if we're eating a poor diet and we're not getting a lot of whole foods and, um, nutritious food, our body will still stay hungry
Mm.
even though we're getting plenty of calories,
Mhm. Mhm.
right? So physical hunger is kind of, well, it depends,
Mm.
right? And I used to, almost 15 years ago, I wrote a book, Mindful Eating for Binge Eating with the great Michelle May. And we talked about, oh, physical hunger is this and emotional hunger is that. But I think it's fuzzy. I think it's
Mm.
fuzzy now in terms of we're not getting enough sleep, um, or quality sleep. Um, and I think, daylight, um, the whole circadian, um, is our clocks are all messed up in our bodies. Um, so there's lots of things. So from a full healing process of trying to bring back those natural hunger and fullness cues is a whole body holistic approach that needs to happen, because we just get out of tune.
Yeah. Yeah, that makes sense, and I mean, there's a part of it that's, like, context and the way that we're moving through society now, and in some ways, I think for many folks with an eating disorder, asking them to go back to their bodies and put this much attention on it or build this awareness can be tough. It's an important ask and a necessary one,
Right.
but there's that tension there, and so
Yeah, that is one of the hardest. I think because I'm older, I've had, I think I look at my body differently
Mm,
because I've reached my 60s, right? And so I'm looking more at health and longevity, and yet I have a lot of compassion
mm,
for I have a 16-year-old that gained 15 pounds and she looks fine. But for me to convince her that she's not in complete danger right
mm,
now, um, it's a very hard thing for me to convince her that she's not gonna be rejected and kicked out of the clan. And if she's kicked out of the clan from a primitive perspective, like our DNA, it's like it's the worst thing that could ever happen. And so I have to be compassionate toward what she's going through because of our, um, which I think we're going through another trend of super skinny. It's
mm,
like, we've seen this. I've seen these through the decades in terms of is it an athletic build? Is it a big bottom? Is it a little bottom or whatever? And then we have, Ariana Grande comes out and she's just a waif, and that's the new trend. So I wouldn't want to go back there, but essentially, um, that is the hardest thing. But I think it's essential for long term healing from an eating disorder, and that is trying to, and this kind of comes back to the theme of my book, is to replace fear with love. Okay. So the whole idea in my book was, but the greatest of these is love. And what it comes back to is, and I'm not talking about love your body, but an absence of fear, an absence of being afraid of your body, that it's so unruly, right?
mm,
That we have to control it and fight it. I mean, think of all the war types of adjectives that we use when it comes to um, the marketing in terms of, waging war with your body, the battle of the bulge or the sinful nature, or, I mean, it's like about food. And so this idea of coming at it maybe even neutrally, right? And not fearfully is that move toward food, not away,
mhm,
right? Move toward our bodies, not away. Befriending, um, long-term recovery is essential that we befriend um our bodies. In fact, the new program that I'm working on now called Metabolic Mindset with um ages 50 plus in
mhm,
terms of women trying to heal that relationship with their body is moving then internal to be befriending even at the level of the mitochondria or the gut bug,
mhm,
right? I mean, I know that sounds a little over the top, but to get people focused on healing, befriending, collaborating instead of fighting from from a perspective of because our body wants to heal itself and it knows how. We just have to stop fighting it. Right?
mm,
We're waging war. But this is the only body we have. It's the only one that we're ever gonna have. It's like we're born with it and it will be with us until we depart. It's the longest, most enduring relationship that we'll ever have. And with food, it's our life force. And without it, we will not thrive, we will not survive.
mm,
So, bodies and food, and then connection, right? There's your trifecta: food, body, and love, right? That's your connection. That's the that's the formula, right? But if we are in a state of fear, um, then essentially and strife, we won't ever be in balance. We won't everything that we need to heal, everything we need for this beautiful body to um, regulate itself, right? If we're throwing things at it to prevent it from doing that, it won't do that.
Mhm. And I like the word befriend for that because in some ways, yeah, we're just seeing like what's the function of my body. And if society is telling me it's acceptance, right, then that's my focus. And just like any friendship, we're constantly learning new things about the other person. And so that psychoeducation piece of like the mitochondria, and understand this piece is like it's a new way to look at your body and understand it. And that entry point maybe is more accessible
Yeah.
for some people.
Well, it's a lot more neutral. Um, and I always say it's kind of like we've got to move intrinsically from this extrinsic focus that we have. What do I look like? How big is my bum? What I mean, it's just takes us completely away from that all the wisdom and the communications that our body is trying to tell us. It talks to us all day long, and if we're cut off from it, we don't know. I mean, the one of the simplest thing is hunger and fullness, but at the same time, there's so much other things. In fact, emotions, right? Anxiety, all of these things. If we are not to fear it and we're to lean in and to listen, there's wisdom in that, and it could tell us something that we need to know. So if I feel anxious, I will befriend my anxiety and I'll say, hey, thank you. You're paying attention. Thanks for protecting me. Thanks for letting me know that things might not be quite right. Let's center ourselves. Okay. I can help you calm down. I can give you a big diaphragmatic breath and a sigh, reset my nervous system. Now, let me lean in. What are you trying to tell me? Okay. Well, as a parent of this body or a good friend,
Mhm.
I can come alongside and I can say, I think we're good. Thanks for letting me know. I'm going to pay attention. Right now, we're going to go do this. I mean, it's like this dialogue that goes on. It's almost like there's a metaphor in act therapy that's really interesting. And the bus. Have you heard of the?
Actually, that was
Okay,
fun.
all right.
Yeah.
So if we allow, and it kind of goes alongside of internal family systems, which I also love because it's a real compassionate base. It's the idea that all these parts, and I see the body as a part. Um, I see the gut as a part. I see, it's not just these personas. It's like we can even use it to help us mend relationships with food, right? So this idea that if we let ourselves or our self leadership, right, which would be our most wise, authentic self, I call it the ventral vagal self. From a polyvagal perspective, that one that can think clearly, that comes out of our cortex, that isn't dysregulated because of and moved into more of our limbic or amygdala um, reactive state, that the one that can pause, right, and make a good choice or a better choice, oftentimes defaults and lets the other parts drive the bus. Our fear parts, for instance, drive the bus. So think about yourself, the self leader, the one that you wake up in when you've had a really great night's sleep, right? The rested self. All your intentions are clear. I know exactly how I'd like to execute my day. This is before we get tired, before we have, our nervous system takes over. But what happens is we default, we go back to the back of the bus and we sit and we let the kids drive the bus. And they take us to wherever they want to go. If they want to turn into the golden arches, they will, right? But if we can keep ourselves regulated enough that we can keep those shifts, co-regulation or self-regulation, and the shift, then our parts are all still there,
Mm.
right? But we're in the driver's seat, And we're making those choices as to where we're driving our life. Um, and we're staying on track, and we can hear the kids in the back of the bus. They can be all bloody murder and crazy. It's like the really good mom that can be driving the minivan and
Mhm.
how she stays so focused and the kids are bouncing off the walls in the back and she doesn't even hear them anymore, right? That's self-leadership, right? So it's about who's driving the bus, right? It's like it doesn't mean that those parts don't go away, the fears and the anxieties and all of that. But when push comes to shove, who's making that decision? And so we need to be able to elevate that part of us that is making the decisions that we're able to pause. And when we can't, that's when I say that's where the speed bumps and the guardrails all come in, is because once we are in that brain fatigue, once we're in that place where I don't have 1 ounce of decision-making power left in me because my nervous system is highly sensitive, it gets worn out early, or I'm in a fight flight or a dysregulated state. In those moments, I have no business making decisions because I'm not my self leader, my authentic self is not driving the bus at that point. So I have no business
Mhm.
trying to make decisions for myself. And so that's why when we get into those states, the best thing for us to do is to have already had a plan in place,
Mm.
right?
Mhm.
Because we can't make decisions anymore. So we have to have those decisions made for us. And we can create those types of environments.
Yeah, that preparation piece
Yeah.
and instead of the fear of, "Is this gonna happen to me again?" Yeah.
It will.
Yeah. Right.
For some people, it happens every day at 4 o'clock
Mhm.
in the afternoon, right?
And, I think shame and guilt sometimes being feelings, obviously, that are a big part of eating disorders and can be the parts that you're talking about. Um, what how do you suggest, like, people navigate that? Of course, we're all different, but in your experience and professionally and personally.
Well, just the same as anger begets anger, shame begets shame. I just think
Mhm.
it gets cyclical. It's like I think that if you were to look at if one of the consequences of poor, choices, ineffective choices, right, is guilt, guilt can then become the trigger,
Mhm. Right.
right? And you start all back over again. The trigger to start all the ineffective behaviors all over again. So you can just get caught in this vicious cycle. And so one of the philosophies that I try to a lot of people are working in the arrears.
Mm.
A lot of people are trying to make up for yesterday or what I did earlier in the day. And so it's like as if our decision making is based on, a bank account and and we've had too many debits and not enough credits. And so I'm going to base my behavior right now in this moment based on what I'm trying to make up for. If
Mhm.
you play that game, you're going to be chasing your tail over and over. And so I always say is that we need to stay in our present accounts and our decision making needs to be based on where we are right now, not based on what happened yesterday or even earlier today. Because we get into the I don't care, right? I already, we've heard this over. I blew it already. I'm not, that's where that black and white. That's why dialectical behavioral therapy is really still very good. I use body-based therapies, but it's really good from the perspective of um not working out of the black and white and the dichotomous thinking process. Because if we can come back and just realize, okay, in this present moment, I need to make a decision not based on the past and not based necessarily on the future,
Mm.
and try to stay current. And so with that, we can please don't bring in guilt and shame. There's no place for it. It's done. It's finished, right?
Mhm.
There's nothing that you can do. Um, you know, as much as you beat yourself up with a big stick, it's not going to help you because we are not motivated by intimidation or fear. Fear is a motivator, is not motivating. It will default to shame every time,
Mm.
right? You can't intend, and that's another philosophy that I have with this, the love concept, is that we cannot find love or be loved. Um, People will not love you or be convinced to love you out of a fear relationship, out of an intimidation relationship. Because when we feel trapped as humans, we panic.
Mm.
We need autonomy. We need choice. We need to be met with an open hand or palm and not a tight fist. So if you think about that in terms of our own relationship with our eating disorders, okay, we can't whip it into shape.
Right.
It's our kindness, right? It's our compassion and our kindness that motivates us, right? And so a lot of people, oh, I'm afraid. I'm afraid to give myself a break. I'm afraid to be kind to myself. I don't, because what if I take advantage of that, right? Right? Then I'll say, well, it doesn't matter. I can just do this and I can do this. And if I forgive myself that quickly, but that's not really the way it works. If we're working with the wise and authentic self, right? It We don't take advantage of that, right? Because that's still fear-based. Getting away with, right? Isn't that fear-based? It's like,
Mhm.
I'm not gonna get caught. I can, right? That's still that sneaky, and that's a whole nother discussion because that's part of the dopamine seeking
Mm.
behavior is securing, right, the goods,
Mm.
chasing the goods, finding it, the seeking, right? And we get is just as much of a hit off of that,
Sure. A cycle is part
right?
of
That
it.
cycle,
Mm.
as much of a reward process from that as anything too.
And, with the DBT, dialectical behavior therapy that you're bringing up, like, I feel like a big part of that is meaning making too, and so even with that shame and guilt or the experiences
Mm.
of relapse or whatever else, it's like, what did I learn about myself for this moment? And guilt can be productive for
Right,
a minute there, but
right.
yeah, I like what you said about you do have to
From
leave.
a understanding.
Mhm. Mm.
Um, but I always say start the very next meal or start the very next morning or whatever,
Mhm.
and just
Yeah.
as if this is it, right? We can't. I mean, some people will starve themselves during the day because they know they have a big dinner coming up, or somebody will starve themselves the next day because they overate the night before. But guess what? The starving leads to, right? It might feel like a great idea in the morning,
Mm.
but my 16-year-old is comes home from school after having not eaten all day, and she's eaten the whole house out, and she doesn't understand, why do I keep doing this? I can't stand myself, right? And I go, well, let's look at the day. So that's when we start to look at the days that went well. And then she understands, oh, I understand it. I had a good breakfast. I had a snack going into my basketball practice.
Yeah, we have to take into account the present in terms of
Mhm.
these are the resources I have. This is the actual information I have. But then that context, which requires knowing ourselves and our body, just like you're talking about.
And the other thing from a restrictive perspective is people that are restricting, they actually get to a place where they're not hungry anymore. So the physical hunger has been turned off. So they go, "But I'm not hungry, Carrie, I'm not." Well, there's a lot of other things that has come into play, other um neurotransmitters and other hormones, other things that are causing that's trying to compensate for
Mm.
what's been going on. So shutting down the hunger, right? And there's even some theory, right? It's an interesting theory about survival is you're too weak to go out and hunt. Okay. So we're going to just slow everything down, stay in the cave that's safer there. Okay. Than you having the energy or the appetite to go out. And let's just, you know, hibernate a little bit here and stay safe rather than to put yourself in jeopardy. Okay, well, that kind of makes sense. Now, you take, for instance, bulimia, which is a whole nother can of worms, but what's actually happening is they start chasing opiates. Okay, so what first started out to be a fear response to a caloric intake, I've got to get rid of this. It can start bulimia can start out like that, right? It's like a compensatory behavior, but then it can turn into a full blown opiate seeking process where you need more and more to feel better. Those that don't understand is when you vomit, it's a natural process. The body says, I've been poisoned, I'm dying, there's something really wrong here. So I'm going to express opiates, endogenous, made from internally in our bodies to make us feel better. Oh, okay, I do feel better. And yet the body still thinks that it was sick, like truly from a dangerous, this could kill me. That's why we throw up in the first place is to get rid of something that's an object of dangerous toxin of some sort.
Mm.
And um, so then we've got a whole nother like reward looping process that we're having to deal with as well. Because if you feel better, remember we come back to the whole what makes you feel better, right? Wow. One of my bulimic clients talks about that calm. It's like the eye of the hurricane after the purge. Like it's silent, it's calm, it's everything. And so now when they become anxious, they will actually binge so they can purge, so they can feel that calm, right? It wasn't about see how it the cycle just continues
Mhm.
to move.
Mhm.
Um
Or seeking a moment of
yeah,
peace, which is
seeking a
an
moment of
example.
peace,
Mhm.
especially those that their mind just won't shut off or their body just won't let them out of that fight flee process. They feel so trapped in that. And yet, right, there are instead of, "Oh no, I'm stressed, I need to get rid of it." If we could help people to understand how through co-regulation or self-regulation, it's just about learning how to shift those energy states, right? We can move, they're not permanent, right? We can move them. We can energize ourselves or we can calm ourselves through lots of different um, temperatures or sensory shifts or going from inside to outside or being alone to with people or from people to alone.
Mhm.
There's just, it's moving and shifting and it doesn't have to be a permanent state. So,
And, you mentioned co-regulation again, and for people because, right, in eating disorders, there's so much isolating and sometimes disruption to the very people that would be helpful to bring into our lives. And so, what can co-regulation look like when someone's dealing with isolation, right? Or doesn't necessarily have those people in their life, or what do they maybe need to do in order to foster that with people?
yeah. Well, I have a chapter in my workbook. that goes with my book, that is about connection and how learning to create safety, educating people on your own nervous system,
Mm,
the safe people that will actually listen and understand that these are the types of things that calm my nervous system down, and these are the things that rev my nervous system up, and so they can partner with you in knowing, or not look at you strangely when you ask, "I need to go into my sanctuary for a little while," like I call it a safe place in the house or the around the office or something that you can get yourself retuned, your nervous system, um, so that they don't feel like, because oftentimes when somebody needs that downtime, some partners will chase them.
sure.
You
Mhm.
say, "I just need a timeout," and they take it as rejection, right? And they're in their fight flight, and you go someplace to try to, and they're chasing you. "Don't leave me, don't," So how do you learn to educate based on the educating on the nervous system and the unique differences? Some people shut down, some people chase,
Mm,
right? Where are they at? So creating within your your surrounding, finding your safe people, educating them on what you need. Um what does support mean? Support people go, I just need you to support me. Well, what the heck does that mean? Because it's so different based on different nervous system profiles,
right.
right? For others, it's like I need more people. For others, I need just a safe one person regulatory experience. It could mean just a hand on the back, right? For others, it's a hug, right? And for some people, that will, feel trapped,
Mhm.
right? And panic. So it just depends on, so trying to figure that out. I always say practice on pets, practice with one safe person. But we are going to have to bring another DBT thing, and you're gonna have to do some opposite action. Um, like what you feel like is a complete threat and awful, I need to move toward, and start testing that and whatnot. And we also cannot ignore how dysregulatory our lack of self care can be.
Mm,
Right? So it kind of starts with the basics of sleep, right? Sunlight, um, nourishment, right? Movement, all the things that are the system needs to feel safe. So if we can create, um, some homeostasis there, it's going to our nervous system is going to be much more able to welcome co-regulation into our lives without it being just one more threat.
mhm. Mm. Well, I have a million other questions for you, and I know we could be here for so long, and I wish we had more time. But I wanna make sure we get to talk about you and projects you're working on. You're a very busy woman. And so fill us in. Where can people
Yeah.
find you and
Yeah.
what you're working on?
Well, I do have my private practice here in Scottsdale. It's also telehealth. I take a very small amount of counseling clients. I don't have any more than 15 at a time, and I give them a lot of attention. It's like concierge. Okay. And at the same time, I also have a coaching business. It's called Food, Body, and Love Coaching, and it's virtual. And so right now, my big project is working on something called Metabolic Mindset, it's an online um, course that turns into a community and has group coaching. And so I've got a beta group going right now. We're going to do a full launch in June.
Mm,
So that's exciting. It's really resonating with people. And this is where it's like moving inward to heal the body. So many people are focused on kind of like the end result. Like I want to lose weight, or I have diabetes and I need to, you know, get to this point. And I'm going, okay, well, if we don't keep homeostasis in our body, we're not going to make good decisions and we're going to find ourselves in the same place 6 months from now,
Mhm.
chasing the scale when we could be learning to keep ourselves into a state where we can make better choices throughout the day. And that ultimately is what we're looking at is behavioral
Mm.
day-to-day choices on care. You know, let's set that scale aside, right? And so that's resonating a little bit with my especially 45 to 75, 80-year-olds. I still have my online course for binge eating disorder that follows my book and workbook. And so that's still available. So there are coaching options. And the reason why it's so important for me to move into this coaching space is because I can either affect 15 individuals at a time, right? And many people can't access me because it's expensive,
Mm.
okay? And I don't take that many on. But think of how many other people I can send this message to and impact if I can keep things at a membership-based cost,
Mm.
right? And they can get all of those things. And so I'm doing it to expand my reach. That's why I've got both a counseling division and a coaching division.
That's awesome,
Yeah.
Kari, and you really run the gamut with things, but you give 100% more than that to everything you do. So, if you're interested in learning more about Kari, her bio will be under this video, and I definitely recommend looking her up. So,
Right.
thanks so much,
Thanks for
Doctor
having me.
Anderson.
Yeah.
I appreciate you.
Yeah.